then. We were meeting after, say, about 25 years, more than 25 years that time.
Oh.
But yeah, he was very kind and very nice. Really, I felt, that was a great loss to us, to all KGMC people as well, and as a senior also, it was a great loss for us. Yeah. So, Dr. Pallavi, I think we can start.
Okay, sir.
You can just, someone of you can just remind Dr. Rajat. I have already reminded him. Maybe.
Okay, sir.
Yeah. In the meantime.
Ipshita, you can start with the webinar. I'll just call Dr. Rajat, sir.
Okay, so should I start then, ma'am?
Yeah.
I think, yes, sir. Okay, sir.
Yeah. We must start.
A very good afternoon to everyone present here today. I, Dr. Ipshita Potlia, on behalf of the Department of Public Health Dentistry, welcome everyone for the first online webinar of the year 2021 on the occasion of World No Tobacco Day. I extend a very warm welcome to our chairperson, Saraswati Group of Institutions, Mrs. Madhu Mathur ma'am, our president, Saraswati Group of Institutions, Dr. Rajat Mathur sir, Director SHRC and BSM School of Nursing, Mrs. Smita Mathur ma'am, our respected principal, Dr. K.N. Dubey sir, Dean PG Studies, Dr. Arvind Tripathi sir, Dean UG Studies, and our Vice Principal, Dr. Saumya Navat sir, heads of all the departments, all our faculty members, postgraduates and undergraduate students. Welcome everyone, and thank you for joining us to celebrate No Tobacco Day, which we are observing this year through this webinar. The theme for this year is Quit Tobacco, Be a Winner. I would also like to take this moment to welcome our speaker for the day, my very dear senior from my alma mater, Davangere, Dr. Denzi Lawrence, sir. Welcome once again, sir. It's a pleasure to have you back. And I would like to request Dr. Pallavi ma'am, Reader, Department of Public Health Dentistry, to kindly introduce us to the speaker.
Thank you, Dr. Ipshita. Before moving on to the topic and our eminent speaker, I would like to extend my gratitude to our chairperson, SDC Mrs. Madhu Mathur ma'am, President SDC Dr. Rajat Mathur sir, Director SHRC and BSM Nursing Mrs. Smita Mathur ma'am, our Principal Dr. K.N. Dubey sir, PG Dean Studies Dr. Arvind Tripathi sir, UG Dean Studies, and Vice Principal Dr. Saumya Navat sir, heads of all the department and faculty for their constant and unconditional support. The World No Tobacco Day is observed every year on 31st May to make tobacco users aware of the opportunity to lead a healthier life. The aim of this day is to spread awareness about the dangers of using tobacco and how health problems can be tackled by doctors when one quits smoking. According to WHO, when the news came out that smokers were more likely to develop severe disease with COVID-19 compared to non-smokers, it triggered millions of smokers to quit tobacco. So the theme for this year is Quit Tobacco to be a winner. The hashtag is sure to inspire the masses and to refrain from tobacco intake. So to enlighten on this topic, we have Dr. Denzi Lawrence, who is a simple man with complex taste, believes in maximizing human potential to the fullest. He has completed his BDS and MDS in Public Health Dentistry Department from Bapuji Dental College and Hospital, Davangere in the year 2016. And now presently he's working as an assistant professor in Department of Public Health Dentistry in same college since 2016. He delivers continuous motivational lectures to focus student groups. He is engaged in co-curricular activities, enrichment programs, and many more. He has won numerous awards in debating, collage, fashion shows, photography.
Pallavi ma'am, sorry to disturb you, but you've muted yourself somehow. Pallavi ma'am, if you could try again.
Ipshita, you can continue with the
last 2 minutes you spoke. We could not hear you.
Yes, ma'am. You got cut out.
Okay. So again, should I repeat it, sir?
Not full, not the full. Only when
Okay.
you talking about the quit tobacco. After that.
Yeah, I think yes, Dr. Pallavi.
I'll just repeat. Okay. The hashtag, the theme for this day is "Quit Tobacco to be a Winner," and the hashtag is sure to inspire the masses and to refrain from tobacco intake. Am I audible, sir?
Yes,
Yes.
Okay. To enlighten on this topic, we have Dr. Denzi Lawrence, who is a simple man with complex taste, believes in maximizing human potential to the fullest. He completed his BDS and MDS in Public Health Dentistry Department from Bapuji Dental College and Hospital, Davangere, in the year 2016. Presently, he is working as an assistant professor in the Department of Public Health Dentistry in same college since 2016. He has delivered continuous motivational lectures to focus students groups, engages in co-curricular activities and enrichment programs, and many more. He has won numerous awards in debating, collage, fashion show, photography, literature, and various extracurricular activities. An academic counselor, verbose lobbyist, diligent writer, and a creative free thinker are some of the roles donned in various capacities. I heartily welcome Dr. Denzi Lawrence to share his knowledge with us on this day. Thank you. Over to you, Ipshita.
Thank you, ma'am. Thank you so much. We very welcome Denzi sir for being with us today. And before I request sir to please start his presentation, I just want to request everyone to kindly keep themselves muted. If participants have any questions, they can put it up in the chat box and we'll address it towards the end of sir's presentation after he's done that. So thank you so much, ma'am. Thank you, everybody. Sir, you may start your presentation now. I will stop sharing my screen.
Yeah. Thank you so much, Dr. Ipshita and Dr. Pallavi, for those really kind words and a very warm introduction. A big shout out to everybody there at STC Lucknow. First things first, thank you everybody from the principal to the various faculty members, the heads of departments, and most of all, dear students, for making our time on this Monday afternoon to attend this session. Okay, so I think with this onset, we can quickly start off this session. Could you let me know, Ipshita, if my screen is being shared?
Can't see it yet, sir.
Yeah, just a minute. Okay. Okay. Can you see the preview of the video?
Yes, sir.
Okay, great. Okay, so good afternoon, everyone. Before we get things on board today, as we've all assembled here on account of World No Tobacco Day, that's May 31st. And in order to celebrate this day and, we having a session and we're connecting with students from STC Lucknow. So thank you so much. And over the next couple of minutes, I'll be sharing whatever little that we could be able to understand in this COVID situation. That is the importance of tobacco cessation in the middle of a crisis. Now, to begin off, I think we'll have a small video which will introduce you to my dear friend Florence, who's actually a creation from the World Health Organization.
Hello.
Hi, I'm Florence from the World Health Organization. I want to talk to you about the harms of using tobacco, including smoking, and how to quit.
Why should I quit smoking?
It's more important than ever to quit during this ongoing COVID-19 pandemic. Smokers are more likely to develop a severe case of COVID-19.
Well, I want to quit, but I've tried before and it's just really hard.
I'm here to help. I can teach you proven techniques to help you quit, tell you why quitting is a good idea, and more. What would you like to talk about?
Well, how do I quit?
Congratulations. Being motivated to quit is the first step. The best way to quit is to build a plan. Are you ready to get started?
All right, so that was our dear friend Florence, which is basically built on an artificial intelligence system. which is an initiative of the World Health Organization. In the time of the COVID or in this pandemic-stricken world, it actually offers you to help quit the habit. Now, the reason why I put this up for you all and all of you participants here, who are watching this from the confines of your home, is that the most often asked question, that whether we should be doing it or not, and all of these things, especially in this situation, it all stems down fundamentally to tobacco cessation, that is doing everything possible. And is it a good time to quit? Okay. Now, when you talk about all these things in terms of tobacco cessation, I wouldn't be going much in detail about the method, but I will be stressing more so on why is it more important, why is it more relevant, and why is it all the more an opportune moment for us to actually consider tobacco cessation and work towards it. And how we dental health professionals can actually go a very, very long way in bringing to forefront the major challenges and opportunities which we come across in tobacco cessation. Okay. Dr. Ipshita, could you tell me everything fine so far?
Yes, all good.
All right, great. Okay, just give me an intimation in case if there's any lag. Okay. Now, coming back to my question for the day, which is tobacco cessation being a challenge during the COVID pandemic. Okay. Now, Dr. Pallavi mentioned about how this is, I would say, the most appropriate, or rather the most relevant time to even consider something like tobacco cessation, which is plaguing the world across the entire perspective. Now, I'd like to highlight a couple of studies and their findings, and this is not, to flatter you with numbers and all that, but just to give you an introspective perspective into what has been done and what were the major findings. Okay, so I've just put together a list of studies, just a few of them, handpicked them, which were conducted in the year 2020, especially at the onset of the COVID pandemic, which try to assess various domains related to tobacco cessation, COVID-19, smoking practices, and so many other kinds of substance use. Now, when you look at some of the studies, they try to associate the connection between the youth, cigarettes, electronic cigarettes with COVID, symptoms, testings, and all of that. So we were able to find out that, that usually the usage of any other kind of e-cigarettes and all of that are significant risk factors for COVID-19. In a couple of studies, we also noticed that there are investigative changes which were checked in alcohol, tobacco consumption before and after the lockdown period, and what were the motives for these changes in the substance use. Now, during the lockdown, individuals consumed slightly more alcohol and smoked marginally more cigarettes compared to the period before the lockdown. Now, this again could be just an incidental finding, again due to boredom, lack of social contacts, and all of these things. Now, not to jump to conclusions based on a few studies, but let's just try to understand that what exactly were the major highlights of this particular series of studies. Now, there was also a study which examined the cigar smokers' perceived risk. Okay, what were the intentions to quit, and what we understand, the intent on the motivation to even change behavior during the pandemic. So it was concluded that all those smokers tried to make an attempt, which is known to be the highest in the time of the lockdown, that there were more users reportedly increasing the tobacco usage due to COVID-19 than decreasing it. So we need to find out and find out more research into what kind of effect this pandemic has on tobacco usage, and accordingly. And there were some broad studies which try to establish a link between tobacco consumption and COVID-19. Okay, so there were many contrasting results which were seen accordingly in this perspective. Now, just to give you an idea about all these things, the reason why I came this, I put these couple of slides, is for us to understand that there is tremendous amount of data which is available. Okay, and it all depends on how we, find it out and how we practice it, and then eventually make use of the entire part. Okay. Now, over the next couple of slides, I will be highlighting about how we can make sure, we can make sure the tobacco cessation, okay, and what can be done in order to escalate it, and dental health professionals, how we can specifically contribute. Now, let's look at the GATS survey. The GATS survey across the world of 2016 and 17 as recent. It has revealed that the level of tobacco usage is very high in India. Okay, that 59% of adults consume some form of tobacco within 30 minutes of waking up. So we understand that there is an increasing burden of disease. Okay, now all of this, as we know, has been clubbed under the non-communicable diseases, is of paramount importance when it talk about the public health aspect. And dental health professionals come across routinely, most of your patients or some of your patients in some form of usage of tobacco. So that automatically puts us in a position of power where we are able to mitigate, we're able to influence the behaviors or the patterns of your patients. So that should be the outcome when you talk about in the larger perspective. Now, like I said, dental health professionals start playing a very crucial role by starting off and giving awareness about the deleterious effects, like we know, of tobacco usage, both as well as oral as well as the systemic health. Okay. Apart from this, we also are expected to provide help and support to tobacco users who are willing to make attempts to quit during the pandemic. Now, there is a lot of content which brings to highlight that, why people are thinking of quitting. Okay. Now, you must understand, because of this forced abstinence, because of limited social circles or being restrictive, in a way, this is an opportune moment for us to even consider tobacco cessation. And there has not been a more relevant period of time for us than this to make this actually happen. Now, COVID-19, there's so much of reporting, and we, as we speak, the country is going through the second wave and the rising cases. We know that it has been a devastating global outbreak. Okay. Now, there has been an increase in the usage of tobacco products in both the smoke as well as the smokeless forms. Now, we have studies which show that the SARS-CoV-2 actually enter the host cells via your angiotensin converting enzyme receptors, which are abundantly present in the lung alveolar tissues. Now, these AC2 levels and furin, the protein convertase, which have been found to be upregulated in the lungs of chronic smokers who are automatically at an increased risk of COVID-19 infection. So just to put facts very clearly here, the science clearly is has got an amount of evidence which is actually indicating towards the increased risk. Now, coming to the more difficult and the more challenging part is, how do we counter it? Now, going back to my question, that is this the perfect time? Absolutely, it is the perfect time to quit. So we need to fuel tobacco cessation in India during the COVID-19 pandemic. And that is the reason why the World Health Organization has actually given, the theme for this year as Commit to Quit and to become a winner, is to make sure of this opportunity and to make sure that we're able to convert this into as many people quitting and leading a tobacco-free and a healthy life for the rest of their entire existence. So this is why this is the perfect time to quit for the entire population. Now, like I said, robust amount of evidence, okay, where you are having comprehensive smoking cessation interventions, okay, of many types. Now, whatever has been recommended by the World Health Organization and through various articles, and the very important Framework Convention on Tobacco Control, which is the FCTC, it has called for parties to increase awareness by using certain policies. Okay. Now, you'd like to know that there's something called the Empower Policy Package and the 2019 Global Tobacco Control Report, where you are supposed to make measures and ensure that there is comprehensive cessation interventions available to the entire population as a part of ongoing tobacco control. Now, all of us here in dental colleges and across, we know that there has been amazing work which has been done by our government as well as the various institutions in setting up TCC, which is the Tobacco Cessation Centers in every dental college, and has become mandatory with a fully functional, intervention in order to help patients on differing levels of dependence. But now, when you look at the COVID situation, because most of the hospitals and the dental colleges are operating at minimal capacities, we will have to look at certain alternatives, okay, to keep the same TCC activities going, but on more of a virtual platform or similar, kind of suggestions, where I will be examining the 5 A's for the present scenario. So this is the whole onset that why we need to make sure these comprehensive smoking cessation interventions, they're absolutely necessary for us to implement. So COVID-19 becomes a tobacco-free opportunity. Okay, so what I mean by this is that we need to make sure that which is a challenge faced by us in terms of the morbidity, the mortality, and the humongous amount of economic crisis which we are facing. It also happens to be an apt tobacco-free opportunity, and that can be done by encouraging and supporting quitting tobacco by giving cessation services by using newer technologies. Okay. Now, how do we reach tobacco users? We could do that by using resources like applications or mobile phones, or even having quit lines. We do have a quit line, national quit line, which gives us access and support for tobacco cessation. Also providing brief advice to quit in healthcare settings, providing teleconsultation services where you're allowing the end user to opt in for cessation advice, and low cost pharmacotherapy, any kind of medications or nicotine, which is NRT, nicotine replacement therapies, and even to simply offer behavioral counseling. Now, this is how we could actually go on and identify and provide this continuous transition from what we're facing right now to actually winning the war against tobacco. Now, what could we do specifically to escalate this during the COVID-19 crisis? Okay. Now, like I said, because of COVID-19, we have a huge amount of evidence. Okay, we have a huge amount of evidence with support. So automatically, what is required for the policymakers and what is required for people in power, okay, is making sure we appraise them with the proper kind of evidence-backed, research-backed evidence, and then make sure that we're assisting the world, over 1 billion tobacco users. Okay, look at what we're dealing with. Okay, who naturally at an increased risk of illness due to COVID-19 probably will get the services to increase the likelihood of quitting tobacco and going towards a tobacco-free world. So overall, when we examine this, the current pandemic has actually given an ideal teachable moment. Okay, when I say teachable moment is when you're identifying and noticing that all of them are able to be in a position where you can bring about some tangible change. So we can promote tobacco cessation, and starting from today, starting from what a better day than today, that is May 31st on World No Tobacco, to accelerate tobacco cessation activities and make sure that they become more and more implemented in various domains and perspectives. Okay, so I hope the content so far has been clear, guys. I mean, any questions or anything which you need more explanation, please do put it in the chat box here, and I shall get getting back to it in the Q&A session towards the end. Okay. Now, moving on, how is the situation in India, right? Now, this situation, pandemic, has hit us, very, very worse. And like they say, right, the virus does not discriminate. It affects everyone equally. Whichever part of the country you are in, you're equally at risk, and you will be in a position where there's a lot of shortage of resources, and all this is happening, right? So this is the time where we have to facilitate massive cessation efforts. Okay, now when I use the word massive, I'm using it precariously, saying that you should do it in terms of a game changer to kick the habit of tobacco for the good from the country. Okay, so actually designating mental health support and tobacco cessation services as essential services, automatically we know that right now all of us are under the Essential Services Act, where there's certain permissible services. So we need to classify this under the essential services, strengthen the teleconsultations and medicines. Okay, whatever we've been using, the internet based and the app based, for example, the Arogya Setu interventions, and actually provide nicotine replacement therapy at subsidized cost, would go actually supporting the cessation efforts during the lockdown. Now, tobacco sales prohibition, like I said, these were implemented, immediately, before and after the lockdown. There has been strict, curbing on the sale of tobacco and alcohol during, the national lockdown last year and in between and presently as well, right? In spite of this, there has been a lot of illegal trafficking and there's been a lot of black marketing. So we need to pay some attention towards that and make sure that we're creating a macro environment where lack of access in itself will probably make people contemplate. Okay, now all of us know tobacco cessation, right? Behavioral interventions brought about by various theories of understanding, right? Now, for example, we have the trans theoretical model where someone goes from a pre-contemplative stage and then goes down to actually quitting the habit. So we need to identify what are the conducive factors which make sure that the patient is able to go from a journey from not even thinking about it to actually thinking about it to eventually quitting the habit. Apart from this, okay, there can be certain language specific, evidence-based tobacco cessation advice, which could be disseminated through mass media. Apart from this, you could also have details of the national quit line number, which is available, and make sure a lot of implementation of your mHealth intervention. Okay, we could actually rope in models, role models from, as like your Bollywood stars who can deliver such messages and motivate users to stay, quit. Now, these interventions, if you remember, played a significant role in other disease control programs, such as TB and polio as well. So apart from this, experts from recognized healthcare institutions can conduct capacity building exercises and online training sessions as well. Now, the call for action, if I have to put this in terminology here, is this must be a cohesive, concerted effort. Okay, I'll just repeat myself, a cohesive, concerted effort towards making sure that this pandemic is used as an opportunity for tobacco usage or cessation. Okay. Now, this is a generalized, we must remember that public health initiatives or anything which is, affecting people at large, they need to be implemented at a macro as well as a micro level. Okay. Now, you can look it up at the upstream, downstream, or the downstream to upstream approach. What is required is a sustained implementation throughout the various levels of interaction. Okay. Now, if you look at the various, content, I just like to put this up for all of them here. Just if you are able to communicate this, okay, tobacco users naturally being at risk, right? Infected with coronavirus, okay, because tobacco usage is a social activity, okay, which limits the safe physical distancing. Automatically, they're more vulnerable to COVID-19 because it requires the contact of fingers, possibly contaminated cigarettes with the mouth, which increases the possibility, okay? And again, sharing of any kind of SLT products also might, increase the risk of corona infection. Now, tobacco users being an increased risk, okay, automatically, reduce the lung capacity, decreases the immunity. Okay, as far as COVID-19 is concerned, it attacks the lungs. So smokers find it harder to quit than the non-smokers. Now, anyone who's exposed to secondhand smoke as well might be similarly vulnerable to COVID-19 infection as the tobacco users. Okay, and tobacco users experience more severe disease progression. Okay, with respect to pulmonary immune function, increase the risk of acquisition of COVID-19, and also severe disease progressions and very, very poor outcomes in smokers. So we have a lot of content, information which has to be disseminated at the very first stage that we need to identify COVID-19 and tobacco usage in itself. Okay, and these have been the result of multiple, systematic, reviews which have been done, meta-analysis, and a lot of research which is published in the entire world. Now, when you look at this, right, tobacco smoke and the various parameters here, all right, let's look at the various impacts of it. Reducing the function of lungs, yes, and then it suppresses the immune system tremendously. It automatically places smokers at risk of respiratory complications, increases the blood pressure, hypertension, and decreases the cardiovascular efficiency. Okay. Now, keeping in mind the age-old adage, right? Like we say, prevention is better than cure. I'd like to go a step ahead and say that prevention is in fact the only cure. Okay, so avoiding limiting usage of tobacco products, and sharing of tobacco devices, and all of these things which are there, which are listed for your reference here, are the general principles which all of you as dental health professionals, as third year students, final year students, interns, all of you could be in your own capacities, make sure that you're able to identify this and put this across to your patients. Okay, put this across because you are automatically in a position of eminence and you're making sure that you're using the situation, the already created awareness about COVID. Okay, you're just coupling this, and that is the reason why I'm reiterating the same fact that this is in fact a far better time ever in the history of tobacco cessation than right now to implement this to the fullest potential. Now, when you look at this, right, COVID-19 situations automatically, what happens in COVID-19 situation, infection, it aggravates your stresses and negative thoughts, okay, the fear of infection. There is a naturally tendency or a likelihood for usage of tobacco products like cigarettes, BD, smokeless forms in various forms, okay? The nicotine is delivered to the brain. There is an appropriate feeling of relaxation, which is the perceived by the patient. Again, nicotine levels begin to get lower, experience withdrawal symptoms, so it makes circumstances worse and difficult to quit. So we must understand, even the ones or the patients who are thinking of quitting, it's not an easy task, okay? Like they say, a lot of empathetic values for the doctor goes into this, right? We need to understand what the patients are actually going through. Okay, when we notice, what they are, facing through in the entire process, we must understand and respect the cycle of what is happening to them. Okay, understanding the level of dependence. In fact, assessing the level of dependence is a very important part of TCC activities. Apart from this, we have to provide the replacements or any other kind of non-pharmacological or pharmacological interventions. So that is the reason why all of you need to understand that what happens in the situation is very, very important. Now, like I said, quickly, I like to run everybody through the 5 A's. Okay, all of you would be aware of this, but then this is something which is modified, in a very condensed fashion for the COVID situation, and that is what we could actually practice in our day-to-day consultations. Okay, the 5 A's begin with ask. Always ask about the tobacco use and document it. Okay, when you're going to go through this tobacco cessation in the COVID situation, please take time and ask in a tone which is conducive to the patient, which is more understandable and empathetic. Okay, so write it down and then make sure your sentences are framed in that way. Next, you have to do is advise the patient. Okay, every tobacco user should be told, that you need to quit in a clear, strong, and a personalized way. Okay, then you're going to be assessing, which is determining the readiness to quit. Okay, ask 2 questions in relation to importance and self-efficacy. Would you like to be a non-tobacco user, or do you think you have a chance of quitting, successfully? Assess the patient. Okay, help the patient build a quit plan. Okay, provide practical counseling, provide intra-treatment social support, any kind of supplementary materials, like information on how to quit and what to do, all these things, and recommend the use of even medication if required. Okay, finally arrange for a follow-up contact with your patient either through telephone or video conferencing. Okay, now these are very, very simple things which are present in tobacco cessation for a very long time. Okay, they just have to be modulated and modified, and usage of teleconsultation or video conferencing, you can actually talk to people who are contemplating and make sure that they get rid of the habit in a very, very uneventful manner. Most of all, I'd like to say reassurance, or rather the very, very foundational basis for all of these things is the importance of reassuring the population, right? You must recognize the public and assure that this stressful time would end soon. Okay, and you must look for ways to alleviate stress and anxiety. So you need to make sure that they indulge in other recreational activities within the confines of their home, within the presence of a lot of distress because of people recovering from COVID and all of these in their surrounding environments. Okay, so reassurance is the key word and what needs to be take home from this session today. Now, understandably, like I said, okay, these are stressful times. Okay, using tobacco is not a solution. Invariably, tobacco use has become an invisible threat along with COVID-19. Okay, now policymakers and stakeholders should understand the demands of the situation and the opportunities that actually lie within. Global examples, such as in the UK, are actually using this opportunity and providing maximum cessation support to the population. Okay, now COVID-19 pandemic would not just impact infection rates, okay, and mortality, but also result in consequences of health inequalities. Okay, you must understand that the ability to fend for care, a lot of inequalities are being arisen. Okay, in fact, in some articles in international publications, they refer to this as the inequality virus. Okay, nothing has broadened the gap between the rich and the poor as much as COVID has. So we must understand there is nothing more universal than man and his healthy environment as well as disease. So if COVID has affected us, it also impacts the infection rates, the mortality, and as a result, consequence actually resulting in health inequalities, which need to be, mandatorily made as an outcome of a policy by any country for that matter. Now, enhancing these tobacco cessation services would actually reduce these inequalities. Okay, it sort of calms down and soothes down the level of addiction, provides supplemental or supporting mental health needs to reduce the effect of comorbidities. Tobacco cessation is also associated with significant health and economic gain for individuals and society at large. So India should now step forward and escalate its cessation services, develop certain comprehensive strategies, and implement the aspects of tobacco control. Okay. Now we all know that everything is going to come to an end, right? This too shall pass. All of us are in the middle of crisis, and especially the startling difference between the last wave and this wave is this wave, someone we know, someone in our inner circles, someone in our social circles or family circles has or has been recovering from COVID, or in some cases has unfortunately lost a family member to COVID, right? So we know that the world will eventually emerge out from this. Okay, along with doing measures for COVID and to reduce the transmissibility by reducing, by getting the population vaccinated, all of these things, we on this World No Tobacco Day also need to make sure that we give more emphasis to tobacco cessation, because that too is an equally important pandemic. So it's essential to act quickly, as we may be able to save a lot of lives and this, delayed kind of effect which is tend to have on an entire population. So in conclusion, right, when you understand this, the whole context of tobacco cessation in the COVID crisis. Okay, please understand that this is not something which is discussed separately. All right. Now, the reason why we decided to have, when we had a talk about this, and I was, invited to speak to all of you all today. The reason we chose this topic was mainly to bring to highlight an importance and impetus which is required, because this topic has not been more relevant than ever before. Okay, and this is actually, like they say, right, there is always an opportunity in crisis. Okay, when we look at opportunity in crisis, we need to make sure that we are looking towards something where making the most out of the existing situation. Okay, and keeping in that mind, the reason the World Health Organization, has come out with this theme, that is, committing to quit and to become a winner, that actually reiterates the fact that all of us needs to come together in this, fight against COVID, and make sure the tobacco cessation is also given that very, very important push. And all of us as dental health professionals, wherever we are, right, we are all equipped with information, we're all equipped with knowledge that we're able to tell and convince, and especially in public health dentistry, it is your primary motive, it is your primary intent to educate the patient and to create awareness. So please pass on this information. Tell people, okay, if you know people who are indulging in the habit, tell them that what are the risks, what are the increased chances, why they are more vulnerable to COVID infections, and why they take a longer time to recover, and eventually what can be done to quit the habit. Okay, so please make this thing, and all of you take a pledge to commit to becoming actually winners in this crusade against tobacco. So with this, I'd like to end my presentation. The whole team of STC Lucknow, thank you so much for this opportunity. I think if we have any question and answers, we can quickly go on and do this. Thank you.
Thank you so much. Thank you so much, Denzi sir. You brought out a wonderful presentation and explained everything so beautifully and simply, especially in today's time. I think understanding the bit of why quitting tobacco becomes even more relevant. I think you've explained that part very nicely. We don't have questions yet, but I think that's because everything was so well explained. So I think everyone got the point.
More than, yeah, can I take a minute, Dipshita?
Oh, sure, sir, please.
Yeah, I think this is a very apt opportunity for all of us to take a pledge, right? So I think all of you could use the chat box, and you could, just extend your support, and you can have a virtual pledge. If it's okay, can we do this? It will take a minute.
Please, sir.
Yeah, I just have a small pledge, which actually I wanted to share. Okay, so I just want to read out something to everybody here, so that all of you give your response in the chat box by actually replying, and you can just put that you do support this, and you commit to quit, right? I think that's more important to way how you can do that. So when you look at this, the whole crusade against tobacco, right? The pledge goes by this thing. I'm not able to share it. Okay, is it okay if I just read it out, Rachita?
Yes, sir.
Yeah, you can.
Yeah. Thank you, sir. Thank you. Okay, so all of us today on May 31st, 2021, okay, on behalf of the organizing committee, we'd like to pledge, something which is the anti-tobacco pledge, okay? So just follow what I say. We will do our best to encourage people who smoke or use tobacco products to quit smoking and using tobacco products. We'll also do our best to guide them by informing about the available services to quit smoking. Now, I and all of us, here take by a pledge that we shall commit to quit and eventually turn out to be a winner. So if you could quickly reply as commit to quit in the chat box, I'd be really, really happy that we would have done something in this direction. So please go ahead and use the chat box, students, and just type hashtag commit to quit. Okay, let me just do it as a sample. Okay. Okay. Okay, so I just want to see the chat box overflow with each one of you, giving their virtual support to this. So
that's already happening. We have many comments coming up.
Lovely, lovely.
That was wonderful. So this is, I think, something we've done for the first time, committing to something and taking a pledge online. So that was wonderful. We
I mean,
experienced this.
uh, the whole idea behind this, Ipshita, is though we are all connected through a digital medium, okay, it's ultimately humanizing the effort. So we are making sure that, especially with the support of your institution management and everybody, and I'm so happy that your principal sir and everybody are here. In fact, has to be, clear to students that you take a commitment towards this. In fact, a little bit of trivia for all the students here is the themes for these World Health days, for the Tobacco Day and all of these things are basically designed in such a way that it brings about a global commitment. And you must understand there's a lot of thinking process between devising these small captions and slogans. Something like committing to quit is in fact a humongous response when we have to go in that detail and to find that. Okay, now just to give a little bit of information to everybody here, the World Health Organization, right, every year it comes out with slogans and content. Okay, they emphasize the idea of truth. Okay, now you must have heard of titles like tobacco kills, don't be duped, and tobacco is deadly in any form of disguise. All of these represent a collective belief from the World Health Organization, which takes into account the entire population. So remember, if you're just typing those letters as simple as committing to quitting something, okay, that itself is a counter response, okay, to make sure that we defeat the marketing strategies and illusions which are created by the tobacco industry. Okay, now the WHO's materials, whichever it publishes, and all of you would have come across through many posters on your social media feeds and everything, they give an alternative understanding of the facts as seen from a global perspective. Okay, now these are an official interpretation of the most up-to-date information on tobacco-related research and statistics, which give us a common ground where we can formulate anti-tobacco arguments and eventually go for it. Okay, so if you look at the couple of 2-3 years previously, right, in a certain year in 2017, tobacco was seen as a threat to development. Okay, in the year 2018, tobacco breaks hearts, and 2019 make every day as a World No Tobacco Day. And in fact, 2020, where tobacco was exposed, okay, they exposed the secrets out of the marketing strategies on how they sell this fake idea of associating tobacco with lifestyle and masculinity and all of these things. This year it has decided on committing to quit. So all of you dear students, if you have done that today, thank yourself and be happy that you have done something in direction to actually fighting this tobacco, and you have given a commitment towards doing it in your own capacities towards a tobacco-free world. So thank you so much for this opportunity and for making this happen. I'm really happy. I can see the whole chat box with that hashtag, and I hope it's going to be just beyond this day for the rest of your practice. Thank you.
Thank you. Thank you so much, sir. I would now like to request our respected principal, sir, to kindly address the gathering.
Yeah, good afternoon, everyone. First of all, I will, before saying anything about the presentation, I will like to, congratulate the presenter, Dr. Danzy Lawrence,
Thank you, sir.
for an excellent and very timed, presentation. It's a very hot topic, not because it is a no tobacco day today, because it is a COVID era. Because both the things are like pandemics. Tobacco is pandemic forever, and this COVID is a pandemic in the last 2 years, and we don't know how long it is going to pull on. So today it's a very, very important day for all of us. And one thing which I have picked up from Dr. Danzy's presentation is that as a health workers, and especially the health workers who are looking to the oral cavities of the patient, they are, the strategy for us has to be a very, very important tool. And that strategy which Dr. Danzy really explained was very impressive as he presented to us as 5 A's, like ask, advise, assess, assist, and arrange. I will just a small suggestion I will like to give to Dr. Denzi,
Sure, sir.
that this arrange should be associate, because the in the last arrange A, you said you will try to follow up the patients, keep on advising them afterwards also. So it is better if you associate yourself to the patient forever. So replace it with the associate if possible. That is one my suggestion.
Sure, sir.
The one thing more I would like to emphasize, that the passion, because tobacco addiction is a passion. The people, they are so passionate about tobacco who are addicted to it, that unless and until they get it, they will search it everywhere. They will find reasons to use it. They will find place to use it, even within the home confines or outside. So they are very passionate. If with the same passion, we as a dentists work for helping such addicts to quit this tobacco and support them forever. So that same passion, if we inculcate in ourselves, then I think the problem will be very easy for us to solve. And the strategy which Dr. Denzi explained in various perspectives, how to consult the patient, how to help them, those all were very, very impressive. I know that Dr. Denzi is working for lot of NGOs. He has been delivering a lot of lectures, informative talks at different forums. He's a well-decorated professional, and he has been graduated and post-graduated from one of prestigious colleges of the country, and is still working there. So I really congratulate him for delivering such a nice talk on No Tobacco Day. And on behalf of this institution, I really thank him for accepting our offer and being with us today, of course in online mode, because the situation does not permit. Otherwise we will like to see him sometimes in our college in an offline mode also.
Absolutely.
I will like to express my gratitudes to our chairperson, Madam Madhu Mathur, President Dr. Rajat Mathur, and Director SHRC, Mrs. Smita Mathur, for providing us this platform, Zoom platform, and motivating us for organizing such activities. Our Dean PG, Dr. Tripathi, Dean UG, Dr. Somenavit, and Professor Kapil Lumba, all HODs, faculty members, they have been very instrumental in helping such activities by being a part of continuing dental education program in our institution. Our students, our interns, UG and PG, they have been participating in one way or other for success of such events. And once again, I will like to say this thing, that this opportunity, because this is a very important word which I caught from Dr. Denzi's talk, that this is an opportunity and we should not let this opportunity slip. I will just quote you one instance, that when I was a postgraduate student in oral and maxillofacial surgery, then we used to have patients with the fracture mandible, where those times, I'm talking of 1981, 82, those years. That time we used to do the intermaxillary fixation. Those days bone plates and all those modern devices were not available. So we used to tie the jaws of the patient. And then when after that patient used to ask her, sir, how I will eat, how I will drink, and how I will smoke. These were the three questions. So we had solution for what he should eat and how the person should eat. But for drinking and for smoking, we used to tell them that this is not permissible. And for 1.5 months, if you quit this alcohol and smoke, then you will be free forever with these bad activities or bad habits. So that was an opportunity, using that opportunity. That is just a small example of using the opportunity. Similarly, this COVID opportunity is also a great opportunity for us. So today we have taken a pledge, and we should, in the true sense, we should, in the true spirit, we should follow our pledges. So thank you very much. And in the end, I will like to congratulate Dr. Dr. Baines, the HOD of PhD department, Dr. Pallavi, and Dr. Ipshita for organizing such a good event and trying to, get in touch with Dr. Denzi for such a nice talk for all of us. So thank you so much.
Thank you, sir. Thank you so much, sir.
Now, on behalf of Saraswati Dental College, Dr. Denzi, I will like to present you with a certificate of appreciation.
Thank you, sir.
And kindly accept it on behalf of my institution.
Thank you, sir. Thank you so much. I think that was really heartwarming, and so much of love and affection from everybody there at STC. I'm really overwhelmed with the response. And the bottom line, I just put a little poem in the chat box for all of you students there. If you could just go through that and understand that the main product, what we are trying to counter today is tobacco, which is taking us out of this situation, in the COVID situation, right? So if you consider this, and if you take home a little bit of information, I think pass this on and try to reach out to as many as you can in your circles, and I would consider my job done. So thank you so much, everybody at STC there. Thank you, Dr. Ipshita. You've been really special, and an amazing junior from Davangere and all the way, and I'm so happy you're doing great there at Lucknow. And Dr. Pallavi, a very awesome senior who have had the pleasure of meeting a couple of occasions at our conferences. Thank you for connecting me with everyone at STC, and thank you, Dr. Dubey sir, for those kind words. And everybody to the management who made this possible. Thank you all. And like I'd say, the take-home message is take home the pledge and commit to quit. Thank you.
Thank you, sir. Thank you so much. Thank you for being with us today. Thank you for taking out time. In fact, it's always a pleasure to listen to you. And you've got all our students to commit to quit. So I'm sure the word is spread like fire now. And I really hope, like Principal Sir said, that someday once the situation gets better, we get to see you here in our institution in person. And with this, we've come to the end of today's presentation and program. I would really like to take this opportunity to thank everyone for joining us today and to observe World No Tobacco Day in our own new manner. A special thank you to our chairperson, Mrs. Madhu Mathur ma'am, our president, Saraswati Group of Institutions, Dr. Rajat Mathur sir, for always encouraging us and for motivating us to keep doing better. Our principal sir, Dr. Kayan Dubey sir, Dean PG Studies, Dr. Arvind Tripathi sir, Dean UG Studies, and our vice principal, Dr. Soumya Navid sir, for their constant support and guidance. A big thank you to all of our respected heads of departments, faculty members, postgraduates, and undergraduate students for taking out time and for joining us today. I would also like to extend my thanks to the technical staff of our college for making this program a huge success. Last but not the least, I would like to thank Dr. Denzi Lawrence sir for giving us such a wonderful and beautiful presentation and for explaining it so wonderfully. Especially now, since COVID has changed everything we know around us. Thank you, everyone. Thank you for joining.
Okay. Take care, everybody. Stay home, stay safe, and stay connected, and keep going. Remember, in times of adversities like this, nothing more than the human spirit to achieve and excel has triumphed. Okay, so this too shall pass, dear students. I think on that note, all of you, see you all very soon. I would be very eager to come to Lucknow and enjoy your tasty kebabs, which is Lucknow famous for. So thank you all so much. See you all. Bye-bye. Thank you, Dr. Pallavi. Thank you, Dr. Ipshita. Thank you, Dr. Dubey. Thank you. And bye-bye to everyone from here. Thank you.